Hi, I'm Dr. Shilpa. So today's topic for discussion is hidden costs in IVF. I think IVF has been a great success story in the recent advances of infertility treatments, and IVF involves a lot of financial aspect to it, and the couple needs to be prepared when they go through the IVF to be financially sound to go through it, and also to successfully come out of it without losing much of their hard-earned savings. So IVF of late, there are so many centers and there are so many options for the patients, and there are so many packages wherein the IVF center advertises as like say free camp, free IUI, free IVF in case if one cycle fail, or packages where it includes a package of 3 cycles, 2 cycles, and if it fails, this is the refund or this is the discount that you're getting. So there is so much of confusion when it comes to the IVF pricing, and also there is a wide range. So it can be at 50,000 and you can still do an IVF in your same city for say like 3 lakhs. So what is it that makes this difference in the price, and how the centers project their financials to the patient? So the actual cost of the IVF can be broken into: one, the injections; second, the medications apart from the IVF, the hormone injections; third is the consumables which they use for the oocyte pickup, like the oocyte pickup needle; and fourth is the media and also the embryology lab, the consumables. So in all these things, the overall cost for the injections could anywhere range between say like 50,000 to a lakh or a lakh and a half, depending on the patient's response, patient's age, patient's weight, and what kind of injections are used on that patient. The second thing which comes to our mind when they use the injections is, is it really worth so much of a cost? Because sometimes per day the injection cost could be around 10 to 12,000. So if we are using say like an imported injection in a higher dosage, then yes, definitely it can go till that. And there is a lot of difference in the MRP and also in the net rate of these injections, especially in local brands. So that I think somewhere where the IVF fertility centers will have the margin. And this I think it is better if the injection charges are all included as a package, because then the patient need not worry about how much extra they will be paying, whether they will require one more injection dosage or one more day, 2 more days, whether they are adding something to it, whether there is anything else that they need to be prepared of as a surprise. All those things will not be there as a question from the patient side if they stick to a package. So packages can range anywhere between 1 lakh to 3 lakhs, and all this will depend on the fertility center's location, the quality of the medications used, the facility of embryology lab, the high-end equipments, and also the consumables quality which they are using. So sometimes because of say various reasons, like if there is increased usage of the medications, then the cost can go up. And that I think if it is included in the package, then the patient need not worry. If it is not included in the package, then the patient has to shell it out. So coming to the embryology aspect of it, so here there will be various costs with regard to the media, with regard to the freezing media, with regard to the consumables, and sometimes there are add-ons, like if they go to till the blastocyst, then they will charge extra. If they do an ICSI, that is injecting the sperm into the egg, and if that is not included in the package, then they will charge extra for that. If they do oocyte activation, it is charged extra. If they use a embryo glue, they will charge extra. If they do a laser assisted hatching, then they will charge extra. So if everything is included in the package as an end-to-end thing, then I think the patient will be more benefited, and they need not worry about the financials of this. And that will be easy for the fertility consultant also, because the decisions decisions will be based solely on their medical expertise and not through the financial gains. So the patient should be aware of all this, and they should discuss openly with the fertility center and the specialist about whether the lab charges, say like doing blood test during this entire procedure, whether it is included, whether the tablets form and gel forms of the medications are included, whether the injections are included, whether freezing charges are included, whether the add-on procedures are included. So if they're not included, if you don't have an idea, then you could be in for a surprise where the IVF can exceed a few lakh rupees than what you have prepared. So we see many a times that the patients take loan, patients go for an EMI facility, patients kind of sell their jewelry, sell their property and come for fertility treatment, and we really feel bad that they are not aware of so many things what happens. And I encourage all the couples to do their bit of homework. They do their bit of finding out from their consultants as to what would be the final thing, have it written, have it signed from the fertility center, so that you don't have to really worry about it when it actually comes to going through in that cycle. So I think this is about general things. If there is anything else, I think you can let us know and we will discuss about it. Thank you so much for watching.